Hey everyone, I'm Dr. Wynn and I'm a chiropractor with Core Chiropractic. And in today's video, I'm going to tell you what a subluxation is and how it causes headaches. And then later in the video, I'm going to show you a chiropractic adjustment that we use that can help with headaches. Let's get started. So what is a subluxation? Here, I'm going to show you this bone model of your spine. Here are your bones. Here's the disc. And then here are the nerves that are running from the brain down to the rest of your body. So a subluxation is whenever there's pressure on the nerves causing problems where they go. Now, how does that happen exactly? It could be the trauma. It can be the accidents that we've sustained in the past that chronically build up, causing that pressure. More often though, we have the day-to-day activities, how we sleep, sit, work, exercise. That can cause the daily stresses that puts pressure by moving these bones out of alignment, puts pressure on these nerves, the stresses on these nerves, causing inflammation, causing that pinching onto those nerves that actually can run up to the neck and can cause the headaches that you're feeling. And a lot of the times, things like tension headache is due to that stress, that inflammation on not just the bones, but the muscles, tendons, ligaments in your bodies that can cause those headaches that you're feeling. So now we know what a subluxation is, and we know that we don't want them in the body. They're bad. We got to get it corrected. So going to a chiropractor, a core chiropractor can actually get that problem solved. Our job is to make sure as chiropractors that the nerves are healthy and happy. And one way of doing that is we're able to feel and touch them. To us, it's going to feel like it's puffy, swollen, even a little bit stuck. On your end or someone else's end that are having subluxations, it can be tender and sensitive. Once we feel that, that's a great way we're able to help people. Then we additionally take x-rays to make sure everything that we see is happening. We don't want to correct without seeing the bones first. In fact, the bones that we see are these ones right here in the neck, and specifically the C1 or atlas and C2 axis. So imagine these tiny bones here being shifted and putting pressure on. You have your head, which typically weighs around 10 pounds. So imagine a bowling ball weighted here. And then over time with the posture, you have a forward-leaning tilt. And that forward-leaning tilt can help put a lot of tension and pressure on the rest of the spine, specifically up in the neck. Now, when that happens, you're going to shift the bones out of alignment. You can cause inflammation, tight muscles, all of that can put pressure, causing the subluxations. And those subluxations there go directly to the neck, to the head, base of the skull, causing your headaches. So after the x-rays, we're able to see exactly how that's aligned and adjust you in the correct manner. And with the adjustment, we're just trying to align, remove the gas bubbles in the neck, and try to realign your spine. That way, it takes pressure off your nerves, gives it some breathing room. And so that's how we're able to identify it, take a look at them on the x-rays to make sure we know how to adjust properly and accurately, precisely. Next, I'm going to show you the adjustments that we use to help correct the subluxations that can be causing your headaches. All right, so this is the adjustment portion, and this is how we help fix those subluxations that are causing headaches. So what I'm feeling for are those subluxations. We have Kenzie here helping me. And so I'm feeling for the upper neck, and that's exactly the closest area that can be causing those headaches. And you feel that one right there, huh, Kenzie?
Yeah.
So we're gonna go ahead and adjust this left upper cervical, upper neck bone. I'm just going to shift it back into place, taking pressure or taking away that subluxation that is causing pressure on the nerves. Right there. Yep, and those cracks are very normal. That's me popping the gas bubbles, getting those bones back into place. And then I reassess it, and there's a lot less pressure, right, Kenzie, off of that bone. All right, so that's what we do. That's one of the adjustments we use for correcting subluxations that are directly causing headaches. If you learned anything, if you found anything useful, go ahead and like. If you want to comment, leave one down below. If you thought that adjustment is something you need, definitely comment. Yeah, and then subscribe. Thanks so much, everyone.